So before doing the procedure, I do have the cotton and the spirit with the forceps. Just I am cleaning the entire ear right now. So just I wanted to clean. Please put little more spirit over here. So we are using the spirit here again, but you should not use more spirit also. That should not go inside the ear. Now I wanted to clean not only the specific area. Remember, it's a very key. Now I wanted to apply the Prof Samiullah. Prof Samiullah is the light 10 point. So I just do like this and then insert the needle. This is the wrong procedure. I wanted to apply the needle over here. I just clean the entire area of this area. Right, then we just insert the needle. In the similar way, wherever you wanted to apply on the ear, you just make sure to clean the entire ear. Is the external ear. Of course, this is very crucial over here. When you wanted to use, of course, you can use back also when you wanted to insert the needle. Now, I just understand about this particular region. Now, I have cleaned everything, but now I wanted to understand to apply one specific area. Just I will take up the lobe in the beginning. So lobe is, again I told you, divided into 9 segments. This the entire lobe is divided into 9 segments. One is the vertical 2 lines and horizontal 2 lines. So which is exactly, now you can see the hole. So this is indicating, in fact this is indicating is the central part of the lobe. So the central part of the lobe is indicating over here to understand, to treat related to the all the oculopathy related problems. Oculo indicating to the vision related disorders can be treatable. Lining, I do have the pain, so that indicating the tongue having some disturbances, mouth having the some problem, or mouth having the ulcers or some kind of the excessive heat or the excessive secretion of the salivary gland, the excessive production of the saliva, which leads to some problems. So all are connected to the lips having the more dryness. So indicating, you just give the pressure, his patient is complaining no pain, that indicating that's the normal. If the patient is complaining mild to moderate pain, something is not the pressure pain, something else having the pain is a unique amount of the pain. That indicating certainly having the some problem in the mouth cavity. When we wanted to understand about the teeth related problem, then you understand the related to the lower teeth and then upper teeth problem. Then the jaws related problem can be treatable by activating this specific region. Now we wanted to know which upper teeth or the lower teeth. So now we understand, remember this is a very important key, the diagnosis and treatment, it get differ from the country to country, the philosophy to philosophy. Chinese philosophy is different from the Western philosophy. Western philosophy having the tooth pain, then you just apply that particular tooth area. But according to the TCM, it is entirely different. The upper teeth is connected to the stomach meridian, Yang-Ming meridian. The lower teeth is connected to the large intestine problems. Then according to that, you just treat one point over here and then point is 1 point for the large intestine. 1 point over here and then the another point for the stomach area also can be treatable. In this way we need to select the auricular therapy. However, now we understand about the jaws related problem. Something is connected to the lower jaw, upper jaw could not able to open the mouth. Today in India the people are very sattvic food they are taking the gutka and nicotine and alcohol so on. So that is the reason people are suffering so many related problems over the period of time. They could not able to open the mouth, that causing the jaws gets the lock. So during that condition the teeth also get impacted. So that particular region we try to focus and apply the needle. So please pass me the half tune needles. Is there with you? Yeah, now we are using the half tune needles. Now the gauge also get differs over here. Now the 26 to 34 gauge can be used, right? But normally we wanted to use the gauge to be 28 gauge. Now I wanted to apply for the vision related problem. You just insert the needle by activating the central part of the lobe. Central part of the lobe is recommended to activate this. So now this is in fact is transverse needling and then cutaneous needling and then perpendicular needling, oblique needling, all also to be considered in auricular also. But generally in the lobe can be applied is the perpendicular or we can apply in the transverse direction. Transverse direction means 0 degree to 15 degree, direction. Now I wanted to apply this slightly upward direction, this to be known as a slightly oblique direction. Right. Now I wanted to apply the another needling for the person who is suffering for the tonsillitis. So that tonsillitis is the lower part of the lobe. We just insert the needle. So now this is treating for the tonsils. But now we wanted to tonsillitis cannot be treatable in 30 minutes or 40 minutes. Of course that takes for the interval of 2 days, 3 days, 4 days, so on. So in that case we have to apply something else needles that will be really useful. Now the vision related problem is not easily can be rectified in the span of a day or two. So however they do have a lot of changes once we insert the needle. But according to the auricular therapy, difference between the scalp and then ear, the majorly scalp can be treatable for all the neurological disorders, whereas in this is auricular disorders can be treatable for the internal organ disorders at the same time for the especially for the pain management. Now we wanted to apply for the vision, so I request you to please pass me the intradermal needle. So press needles. Yeah, you just now this is the press needles are there. This called as a intradermal needle, or the another name to be known as a cutaneous needles. Right. Now I wanted to use, I just withdraw the one needle, I just withdraw the vision needle and then also the tonsils needle. Now just I am disposing this. Now I wanted to use the intradermal needle. Remember I have taken this one needle. This is the intradermal needle, you can see. I just hang it with the tip of the probe. I wanted to apply over on the vision area. Now you understand this particular point really will be treatable for all the vision related disturbances. No doubt vision is not connected to the one particular point. This is related to the correspondence system of the ear. But now we wanted to understand what are the base and origin to cause the vision related problem. According to the TCM, which is connected to the liver, which is connected to the gallbladder. Of course, you just try to focus that and also treat for the occipital nerve is the lesser occipital nerve is the important. Optic nerve is the important. Oculomotor nerve is important. We treat for the nervous system also. We treat for the cranial nerves also. But however, as a local point, now you understand when we are inserting this, you make sure that keep pressing this for the span of it 3 times in a day. So just press and then release, press and then release, press and then release. So this will be really useful to treat for the numerous conditions of the vision. But after, so it will fall down on their own. So definitely we need not to worry about it. If that's falling, because of taking the shower it's falling down, that also you can leave it again. The patient comes to you, you just insert the one more time by using these press needles called as a intradermal needles. Right. So now because this is nothing but is the adhesive tape, but adhesive tape is enclosed for the embedding needles. Right. This is one procedure. The second procedure to be known as when we wanted to use the Vaccaria seeds. So there are the seeds therapy. We can use this to be known as a Semens Vaccaria sagittalis seeds. Right. So these are the seeds, are the medicinal seeds. This will be definitely useful to place this. Now just I have taken in the probe. So I wanted to apply to the tonsillitis. The person is suffering for the tonsil related problem. I just placed this and then pressed over that region. Let it be remain for the same. So minimum a day, minimum 1 hour to you remember, maximum 7 days can be recommended. If this will fall down, let it be fall down. If it is there, then definitely maximum 7 days. Again, we have to replace that and then reinsert the needle or reinsert the pressing needles or something that will be really helpful to the patient. For the span of short period, they feel drastically changes. Again, of course, the tonsils we are treating, then again without having the proper guidelines, the people who consume all the unwanted substances, again that definitely reflect the problem. Avoid the prohibited, what are the foods, definitely that can be prohibited, then you just treat the patient, that will be really good. So now we completed now the inner ear related problem. Something is there, the inner ear which causing the problem, semicircular canals, cochlear now, and middle ear, the step miss, what we call as a malleus, incus stapes, the eustachian tube related problem. So that particular time we just insert the needle towards the, you just place the needle exactly and then apply to the inner ear. This particular point to be known as a inner ear. Inner ear is indicating all the internal ear related problem. Remember, this is key. When the patient get imbalances in the walking, that time the patient doesn't feel good, comfortable when having the vertigo and then giddiness and also imbalances and equilibrium related problem. Definitely we can add up this inner ear. Remember, there is another area to be called as a cerebellum. Cerebellum is important to treat for the equilibrium disorders and also for the coordination purpose. So hopefully we have completed the entire lobe. Majorly we remember the tongue related problem, eye related issues, tonsil related, jaws related, inner ear related problem. So majorly the teeth related issues. Right. So now we recognize the entire lobe. So lobe, once we understand, so day-to-day clinical practice we get the patients. So once you just apply this anywhere, any point by using the any kind of the modalities, by press needle or the seed needles or something is the filiform needles, that also quite enough to treat the patient. So along with that you wanted to add up the macro acupuncture point, that also awesome that so integratedly can be possible. You wanted to add up the another scalp acupuncture together. Scalp is giving the commanding to the entire system of the body. Ear also is the very rich nerve supply to the ear, that also giving information to the cerebral cortex of the brain. At the same time, macro acupuncture also recommended to give the treatment by using integrated way of the treatment by using the auricular.
Sir, can we do for both the lobes or only?
Yes, exactly. Both the lobes can. If the right eye is affected, you can use the right eye. If the left eye is affected, is the left eye. Or you wanted to use the single side, that also quite enough. Not required to use both the sides. But of course, if you are using is the bilaterally, there is no harm. Right. So if you remove more bullying.
Sir, drugs avoid.